Is this government going too far? These are New York City ads. The mayor of New York took a lot of heat because he said, I'm tired of it. I'm tired of paying for amputations and heart attacks and all this stuff because somebody wants to drink a bunch of dang sugar. And they said, well, my mom read the advertisement when I was a baby. You saw it. Well, now I'm going to pull it down on the physicians, because here's an inconvenient truth. Physicians know all this. I'm not telling you anything that any physician up here doesn't already know. Then why the hell aren't they motivated? Because there's a few who are evangelical, like C. Everett Koop, who will, regardless of the price, preach. But most won't. Most are motivated by the same things that motivate other people. Sorry. And what's the number one motivator? Oh, tell me it's not true. We're above that. We're healthcare. Healthcare has nothing to do with dollars, does it? 1/5 of the country's economy has a lot to do with dollars. So the inconvenient truth is what? The government's realized the only way you're going to change a physician is to change their pocketbook. You know what? I say more power to them, because they're right. We're now been asked to undergo what's called a meaningful use. They call it an incentive program. That's code language for dollars are either going to go to you or not based upon how you behave, physician. And isn't it interesting that all physicians in the country and systems will have to report on weight screening and follow-up and tobacco assessment? Well, what do you mean I have to report? Because if I report, these are the dollars that come to me as an individual physician, $63,000. If I report on those. Wow. Even more impressive is after the reporting period's over, I start losing money at 1% a year if I don't report and show that I've done something about it. Same doctors, same patients. Only thing I've changed is how much money's going to who. Within a few months, this now is our new OU Physicians EMR chart field. And you'll notice it says, do you use tobacco? And if you do, have I talked to you about it? Have I referred you somewhere? Have I given you a module? It's starting to sound like baby friendly or something. I don't know. But it's just like, oh my God. And then look down here, weight management. And what is the BMI? And if I found it, did I give them a handout? Have I given them a bill? We don't have any place to refer the patients yet. If we did, I'd have that checkbox. Okay? What am I telling you? Because the dollars came up, within a few months, all of a sudden, every physician and every patient on this campus, 500,000 visits a year, this field comes up and has to be filled out, or the EMR can't keep going. Why? Because I got to get to the green bar. If I get to the green bar, I get a bunch of money. If I don't get to the green bar, I don't get the money. Matter of fact, I start losing money. So guess what? We're going to get to the green bar. Do I know a lot more about tobacco use than I did 3 months ago? This group of 500 physicians has all of a sudden had a bunch of education programs on tobacco? No. Do you think we had a whole bunch of education programs on what it means to be fat? No. We just said, okay, if you're going to put dollars down there, we're going to change our behavior. That's kind of an inconvenient truth, isn't it? There's our BMI. We haven't quite hit our goal yet. We'll get there, trust me. Take it one step further. Does anybody know what the Cleveland Clinic did? You know, Cleveland Clinic, President Obama used in his debate with Mitt Romney. I don't know if you guys remember that, right? And he said Cleveland Clinic is the example of what healthcare in America should be. Now, they don't take care of anybody that's uninsured or underinsured, but we're not going to go there. But other than that, if you're highly insured and you go to the Cleveland Clinic, it's healthcare the way it should be. Okay? And President Obama said that. He was bragging on them. You know what their policy is on these issues? They not only have a smoke-free campus, they don't even hire smokers. If you apply to the Cleveland Clinic system, which is one of the largest economic engines in all of Cleveland, it's like this campus, it's huge. And they do a urine screen test on you. Not for drugs, not for anabolic steroids, for cotton, which is nicotine breakdown product, which stays in your urine forever. And if it's positive, they say, we're not going to hire you. Go away. Wow. Now think if every company in the United States, including the government, had the same policy. You think we'd still have 30% of Oklahoma smoking? Don't think so. That's the power of finances. That's the power of public policy. They've gone further. They want to start with smoking and smokers, but we don't use trans fats anymore. I'm going to give you a free gym membership if you join our team. You're not going to get 26 packets of sugar on our campus. And if you make good decisions, it's going to cost you as an individual less money. Okay. Now let's get to breastfeeding. Are we happy with these? If we were happy, you guys wouldn't be here. Not very pretty numbers, are they? You guys know these numbers. I'm not giving you data you don't know. Well. The first person to bring this issue up, once again, was our old evangelical C. Everett Koop, 1984. It's not rocket science. After looking at the data, lucky is a child who gets to nurse until he's 2. Nobody's disputing that. There's absolutely no dispute to that. There's no healthcare provider that could stand up here and dispute that. He tried to get some federal policy going on breastfeeding to help out, working on 6 areas. I like the public education because I think the public needed to be education. The world of work, professional education, healthcare system, support services, and research. And, I'm stepping on my microphone. And with that, he planted the seed for a lot of things you guys are now following through on. We did sign on to the Innocenti Declaration in 1990. We did have the 1999 Surgeon General report with a blueprint for action on breastfeeding, which has been something all of us have worked with. In the Surgeon General's 2011 call to action on breastfeeding, which once again you've learned more about and you guys are experts on, continues with this, but it emphasizes this improvement in maternity care systems, gaps of knowledge, clinicians, knowledge and skills. All those are important. You know, I wish I was at that meeting. I wish Koop was at that meeting, because I think this would have been a bullet point. If I paid you $2,500 to deliver a baby in your hospital. That's what I paid the hospital if they were not breastfeeding. And I paid you $5,000 if they were breastfeeding. As a society, I come out ahead. How many hospitals do you think would not be baby-friendly? We would be Sweden, where 100% are baby-friendly. Because that's what they do in Sweden. You want to drive a system, whether it's a physician or a hospital, you got to get to where the dollars are. Kids say the darndest thing. Art Linkletter had that show. And Bill Cosby took it over. And it's just the greatest things. But, sometimes you just wonder if I would publish all the things I hear or that nurses hear, physicians say. It blows you away, doesn't it? It's pretty common, right? Newborn mom, this is y'all's world. I'm worried if my baby's getting enough milk. What do I do? Pediatrician, OB-GYN, what do I do? Real quote, it's okay to give formula. My kids were fed formula and they're not retarded. Not only that, I can act on that statement. I'll go get you the formula. Wow. Do you think that physician didn't know what the right answer was? But see, the default mode for that physician was, I'm not getting paid anything to spend time and educate this patient and go through all that. I can just solve it with a pill. Why do physicians prescribe so many antibiotics? Do you think that they work? They just want the patients to go away. Here's an antibiotic. Just go away. But doctor, my kid has an ear infection. They need antibiotics. Sure. So how long did that take me? Sure. Now, no, you don't understand. There's been a major conference that's been put together by the NIH, and they've just put out a report, and the report looks at all these different factors and what we realize. And at the end of 10 minutes, the mother goes, you mean you're not going to give me antibiotics? Oh, yeah, here they are. Okay. But if I wrote that antibiotic prescription and I made $20 less, guess what? I wouldn't write it. I feel guilty. I'm a physician. Guilty is charged. We have let our patients down. I am not going to apologize for our unwillingness to address these public health issues. Interestingly, if you're really going to get somebody to breastfeed, make it a physician. Just really work hard on that, okay? Because all of a sudden they become advocates. When you look at the background action framing it, it said support is more important than promotion, and we need environmental and policy recommendations instead of individual recommendations. So part of Baby Friendly is about environment and policy. I think that that's the key. I think that's the key for hospital systems and physicians. And this is from the 2011 call to action. We have the mother and baby here, and we're surrounded by coworkers, family members, friends, other mothers, clinicians and health professionals. That's what I'm talking about today. Child care providers, employers, worksite communities, doctors' offices, universities and medical schools, lactation professionals. We get a little further out here, health professional organizations, advocacy groups, WIC agencies, state partners. Now we're getting out into these community organizations, and we finally get way out here, Joint Commission, Institute of Medicine, Breastfeeding Committee, federal agency, federal government, kind of surrounded by this blue government. If you look at countries who are successful in breastfeeding, it's because that blue government put their money where their mouth was. Period. That influences how hospitals and physicians take care of patients. It's not the only thing. It's not the only thing. I was asked to address, what I was asked to address was just this. Okay, I'm just that little dot. That's all I am. But I think Edmund Burke was right. I think we do have to think about our history. We have to think about our history with other major public health care things. We have to look at why is there resistance to doing what we all know is correct. There is. We all feel it. And we have to attack it in multiple ways. So I appreciate you guys bearing with me through this. I think you guys are incredible advocates. I applaud the fact that you're here. I applaud the fact that your hospitals were willing to pay for you to come here. And you guys can go back to your community and advocate on these more global levels. Because that's what it's going to take for us to really change. So yes, you're individual, but the structure that Baby Friendly allows you to impart, that addresses so many of these issues, I think is critical. And then when you're working with the physicians, educate them, that one sheet. You just hand them that sheet. If they struggle with understanding what that means, put behind it, this is what tobacco use does. I mean, it's like pretty straightforward. Lung cancer, COPD, heart attack, stroke. Okay, I know that as a physician. Okay, here's what absence of breastfeeding does for your patient. Well, I know that. Well, then let's go make a difference. So I think that that's the message I would advocate for you guys. Okay, I'm done. I have a few minutes for questions. If you have time for questions. Okay, a few minutes for questions from anybody in the audience. I told Becky I was going to do it different. Yes?
I was just going to point out how long Dr. Coop lived. 96 years.
Yep.
I think most of those were active.
Yep. Amazing individual. All right. Well, it's my pleasure once again. Thank you. Oh, another question?
Since we see the difference this makes being supported by the government, we see what a poor job our state government is doing. Has anybody actually taken you or somebody taking something like this to our state legislator? I know they give the information, but you very well point this out. Has that been done, or is that in the course of the
Oklahoma is a particular challenge. We have bright, shining stars. And when we find one of those, we need to support them. So when Mick Cornett said, I want to do something to help the health of Oklahoma City, we need to, as healthcare providers, say yes. When Mary Fallon stands up and says, I disagree with my Republican colleagues in the legislature, we do need to have policy to ban smoking, public policy. She needs support. She needs letters from you. She needs people in your community to understand that was a bold thing for her to do. Now, I've got major issues with her on other health care policies, but when they do something right, it's kind of like a dog. You reward them, you support them, you do the best you can to help. But no, I would say Oklahoma is a particularly challenging state, as our healthcare statistics would indicate. Yes, ma'am.
My question is, how do you address those kind of personal, I know I did the wrong thing, but it's okay to do the wrong thing too, type of thing?
I think there's better people in this room that could answer that. I get a little cynical sometimes. Somebody brought that up with Becky one time. She goes, gosh, and if they had breastfed, they would have probably been geniuses. So just step back a second and say, look, I can smoke for 50 years and not have any bad health effects. It isn't about the individual. It's about public health. We know that tobacco is destroying our society. Can I bring a smoker up here who's not individually destroyed? Yes. But we also know the data. So can I bring up a formula-fed infant that's doing fine? Sure. But I also know the data. Public health isn't about an individual anecdotal story. So I think that's why that 2011 call to action, evidence-based medicine, one sheet that says, look, where breastfeeding improves above the baseline. It's not so much you're damaging with formula, don't go that direction, but you're improving with breastfeeding. So maybe that's the strategy you take. I think that's a great lunch conversation to have with other people that are more experienced, that have dealt with maybe very strong-willed physicians. Yeah, like Barbara.
I would like to see more speaking out from physicians.
Yeah.
Peer-to-peer support. There are a lot of champions, and if that can start somehow as a grassroots thing with a COG, AAP, hey, we're going to stand up and talk about this. And
Yep.
calling out those that
I think what you...
a lot of times they won't listen,
Right.
and it's hard. So I think that's what, there's a lot of things that I wish that the physician groups would be more vocal about.
Me too, but I think they become more vocal if it aligns with other components of the broader system. That's code word for finances. Great discussion. Thank you guys once again.